My doctor informed me after several years of PSA testing that it had gone over 4 and recommended I see a urologist, which I did. And by the time I'd seen the urologist for a month or two, it had gotten to 6.8, and he recommended we do something, and I was very anxious to do something. So I started researching different procedures, first of which was the prostatectomy. And obviously at my age I'd had several friends who have had prostatectomies, and it became pretty obvious to me that I didn't want a prostatectomy. Number one, there's a recurrence factor there. Number two, it's a very serious operation, I found out. But unfortunately, the incentive for people with prostate problems is get it out, take it out. And that's, the more I looked into that, the less attractive it was. I also considered cryotherapy, and that's also a fairly serious problem, and there's no recourse after that. And I looked into proton therapy, long, involved procedure. You had to get an apartment near the facility. And that didn't appeal to me. Radiation didn't appeal to me. So I started researching my options. I was fortunate enough to have more or less an intermediate situation, and so I had the luxury of just enough time, but still I was waking up every day with cancer, and that encouraged me to get some treatment. I wanted the treatment, so I started researching thoroughly, and I ran across the Sperling Cancer Institute. And the more I looked into that, the more appealing it was. It's very obvious that it's so non-invasive and so little collateral damage that I said, this sounds like something that I want to look into. And I listened to the interviews with Dr. Sperling, and I looked into the treatment, and it just sounded like this is the way to go. Particularly, it didn't rule out any future treatments. So I said, let's look into this. It's fairly expensive, and the insurance at that point didn't cover it. I wanted the treatment, regardless of the insurance. And so I got the treatment. I'd had an earlier biopsy, which was not done by Sperling, although I wish it had been, because I just had another biopsy yesterday, and it was just absolutely easy. The first biopsy I had indicated that I did need some treatment. It basically didn't affect my, other than the time spent up here a couple of days, I didn't have any physical drawbacks at all. There was nothing there.